Hi, this is Dr. Jaya Sharma, the founder and director of the Noble IVF Aligarh. Today I am going to discuss the frozen embryo transfer technique. What is frozen embryo transfer? Why it is done? What is it? What is the results? Now, with the advancement in technology, we are having so much new technology. This is one of the technology that we are getting good results in IVF nowadays. Frozen embryo transfer means we do freeze the embryos. Those are surplus or those embryos we cannot transfer to your uterus at that time. We freeze them for further utilization of embryo in future cycles. So what are these conditions? First, when we get embryos being made in a large quantity, means surplus number being achieved in one stimulation cycle, or when we made eggs and we got high number of eggs, then high number of embryos, more than what we transfer to your uterus, the surplus embryos being vitrified or frozen with the liquid nitrogen for the future use of your future cycle. In other terms, when we are having the egg donor program or third party reproduction, in that we make embryo separately and we prepare our lining separately. This can coincide and sometimes this is not coincide. So we made embryo first, then your lining, then we transfer those frozen embryos to your uterus. In the other things, when there is female and male factor, severe female factor or severe male factor, sometimes we got donor embryos. Those donor embryos being frozen in our donor banks and we transfer to those frozen embryos to your uterus. Other things like PCOD patients, when we made those eggs from your ovaries, sometimes your hormone level are so high that we cannot transfer those embryos or those embryos to the same cycle because of complication like hyperstimulation syndrome. So we freeze all of your embryos, we just reduce your hormones, get your cycle normal, get your body normal out of those high hormones. Then in the next future cycle, we prepare your lining, we prepare of uterus and we transfer to those embryos. And it is said that always the results and the positive pregnancy rates are high in frozen embryo transfer than fresh transfer. So the freezing techniques, this vitrification, that FET is real boon to IVF facility of IVF treatment. We are getting better and better result by freezing and transferring in the later cycles. So out of the improving our result for the donor, for the PCOD, for complication prevention, we use freezing, then subsequent transfer of your frozen. That is the technique we known as a frozen embryo transfer. Thank you.